I think that what you're doing to raise awareness about this is one of the best things I've seen in a long time. Because you and I both know that type 1 diabetes, autoimmune diabetes, whether it's LADA or juvenile type 1, whatever you want to call it, happen, a significant number get this after age 21. I see numbers as high as 50 to 60% of people with what we would call type 1 diabetes or LADA get it after age 21. Okay. So it undermines the diagnosis of type 1 being diabetes being a children's disease. It's pretty much an all ages disease, and people need to be made more aware of that. So they do these definitive tests, do these special antibody tests when they get anybody that comes in for high blood sugars, regardless of what they look like.
Right.
Because I have been surprised when I've seen children I would have thought may have had type 2 diabetes. And in fact, if you look at the data from the all the studies in the last 20 years, roughly 10 to 15% of children that have diabetes that would otherwise appear to be type 2 with insulin resistance and being overweight and such actually have markers, antibody markers of type 1 diabetes. And that creates a whole lot of discussion about, well, what type are we going to call this? Is it type 1? Is it type 2? Is it somewhere in between? And there are people you can get on this podcast who will go into great detail about how they like to label that, whether you call it a 1.5 or a 3. There's just all sorts of different ways you can frame that. But checking those antibodies to me seems to be an essential thing to do with anybody who's an adult that gets diagnosed with diabetes, so you don't miss the autoimmune component.